We will start with pharmacology MRCP notes. This is serotonin syndrome. The causes of serotonin syndromes are MAO inhibitors, SSRIs like St. John's wort, ecstasy, amphetamines. It has got a faster onset. It takes hours to occur. There is increase in the reflexes like clonus and dilated pupils. Clinical features will be neuromuscular excitation, hyperreflexia, myoclonus, rigidity, altered mental state, confusion. There will be tachycardia, increase in the blood pressure, pyrexia, and diaphoresis. Management, you will give IV fluid and benzodiazepine, serotonin antagonists like cyproheptadine and chlorpromazine. Now we'll come to neuroleptic malignant syndrome. There's 100% 10% mortality in this. Okay. So antipsychotic medications, atypical antipsychotics, dopamine drugs like levodopa can cause these. Levomipramazine, one of the antipsychotic which often comes in the exam. These will block the dopamine and cause massive glutamate release, subsequently causing neurotoxicity, muscle damage, and autonomic lability, which will cause hypertension, tachycardia, and tachypnea. It will occur within hours to days of starting the antipsychotics. There will be pyrexia, there will be muscle rigidity. The patient will be in agitated delirium with confusion. The reflexes will decrease, lead pipe rigidity will be seen in this case. There will be increase in the creatinine kinase, acute kidney injury secondary to rhabdomyolysis, leukocytosis may also be seen. Management, you have to stop the antipsychotics, give IV fluid to prevent renal failure. Dantrolene is given. This decreases excitation contraction coupling in skeletal muscle by binding to ryanodine receptors. It decreases release of calcium from sarcoplasmic reticulum. Bromocriptine dopamine agonist may also be used. So we'll see the antibiotics which are involved. Cell wall formation. Antibiotics which inhibit the cell wall formation are peptidoglycan cross-linking inhibitors, which are penicillin, cephalosporins, carbapenems. Synthesis के लिए glycopeptides like vancomycin, which help in the which inhibit synthesis are glycopeptide vancomycin. Drugs which act on the DNA topoisomerase are quinolones. Drug which damage the DNA is metronidazole. Drugs which act on the 50S subunits are macrolides, chloramphenicol, clindamycin, linezolid, streptogramins. 30S act on the 30S subunit of ribosomes are aminoglycosides, tetracyclines. Sulfonamides, dihydropsynthesis. PABA is converted to DHF with the help of this, and DHF is converted to tetrahydrofolate with the help of DHFR. Now trimethoprim is something which will inhibit DHFR. Okay? Sulfonamide will inhibit this dihydropeptosynthetase. mRNA of the bacteria is inhibited by RNA inhibited by rifampicin. Okay? Cyclosporin decreases clonal proliferation of T cells by reducing interleukin 2 release, act by binding to cyclophrelin, forming a complex which inhibits calcineurin, a phosphatase that activates various transcription factors in T cells. Virtually non-myelotoxic, liver toxicity seen, kidney toxicity, fluid retention, hypertension, hyperkalemia, hypertrichosis, gingival hyperplasia, tremor, impaired glucose tolerance, hyperlipidemia, and increased susceptibility to severe infection. So cyclosporin is a very important drug in MRCP examination, and it has to be learnt. This has to be learnt. Indication: organ transplantation, rheumatoid arthritis, psoriasis, direct keratinocytes modulating T cell function, ulcerative colitis, pure red cell aplasia. Drugs causing lung fibrosis are amiodarone, cytotoxic agents like busulfan, bleomycin, anti-rheumatoid arthritis drugs, methotrexate, sulfasalazine, nitrofurantoin, ergot derivatives agonists like bromocriptine, cabergoline, and pergolide. Cocaine alkaloid derivative. Mechanism of action is it will block the uptake of dopamine, noradrenaline, more they are the same, serotonin. Cardiovascular effects: coronary artery spasm, MI, tachycardia, bradycardia, hypertension, QRS widening, QT production, aortic dissection. Neurological effects: seizure, mydriasis, hypertonia, hyperreflexia. Others are ischemic colitis, abdominal pain, hyperthermia, metabolic acidosis and rhabdomyolysis. Rectal bleeding can cause preterm labor. Psychiatric agitation, psychosis, hallucination. Management is benzodiazepine is first line, chest pain, benzodiazepine, GTN infusion. And if MI develops, then primary PCI, hypertension, benzodiazepine plus sodium nitroprusside. I will just read this again. Cocaine alkaloid derivative. Mechanism of action: it blocks the uptake of dopamine, norepinephrine, serotonin. Cardiovascular effects: coronary artery spasm, it can cause MI, tachycardia and bradycardia both, hypertension, QRS widening, QT prolongation, aortic dissection, psychology, agitation, psychosis, hallucination. Neurological effects: it causes seizures, mydriasis, hypertonia, hyperreflexia. So cocaine causes mydriasis. Others: ischemic colitis, abdominal pain, hyperthermia, metabolic acidosis, rhabdomyolysis, rectal bleeding. It can cause preterm labor as well. Management: benzodiazepine is the first line. If the patient has got chest pain, then you give benzodiazepine with GTN infusion. If MI develops, then primary PCI, hypertension, benzodiazepine plus sodium nitroprusside can be given. Carbon monoxide poisoning: left shift of the oxygen dissociation curve, tissue hypoxia. Badly maintained house will be in the history. Clinical feature: headache 90%, nausea, vomiting, vertigo, confusion, subjective weakness, pink skin, mucosae, hyperpyrexia, arrhythmia. Clinical features include coma and death. Pulse ox falsely high, carboxyhemoglobin less than 3%, non-smokers and less than 10% in smokers. 10 to 30% symptoms, more than 30% severe toxicity. ECG useful, supplement investigation to look for cardiac ischemia. Management: 100% high flow, non-rebreathable mask, minimum 6 hours, and hyperbaric oxygen. Drugs causing photosensitivity: thiazides, tetracyclines, sulfonamides, ciprofloxacin, amiodarone, NSAIDs, example piroxicam, soralin, sulfonylureas. Beta blocker overdose: clinical feature bradycardia, hypertension, heart failure, syncope. Management: bradycardia, then atropine. Resistant cases, glucagon may be used. Hemodialysis not effective. Motion sickness describes nausea and vomiting which occurs when discrepancy occurs visually perceived movements and vestibular systems. Management: hyoscine most effective, limited due to side effects cyclizin and cinnarizin. Macrolides: these act by inhibiting bacterial protein synthesis by blocking translocation. They mainly inhibit the 50S subunit on the ribosomes. These include erythromycin, clarithromycin, azithromycin. Mechanism of resistance is post-transcription methylation on 23S bacterial ribosomes RNA. Adverse effect: it causes prolongation of QT interval, GIT side effect is most common, nausea less with clarithromycin, erythromycin. Cholestatic jaundice risk may be decreased if erythromycin stearate is used. P450 inhibitors are these. Azithromycin causes hearing loss and tinnitus. Erythromycin is used in gastroparesis, prokinetic properties. Common interactions: statins. Statins should be stopped while taking macrolides as it inhibits cytochrome P450, isoniazid and CYP3A4. Erythromycin may potentially interact with amiodarone, warfarin and simvastatin. Heparin acts by activating antithrombin 3. Unfractionated heparin inhibits thrombin factor 10A, 9A, 11A and 12A. Low molecular weight heparin increases the action of antithrombin 3 on factor 10A. Adverse effect includes bleeding, thrombocytopenia, osteoporosis and increase in renal risk factors of features. Hyperkalemia, inhibition of aldosterone secretion. The difference between standard heparin and low molecular weight heparin. Standard heparin can be given IV, this is given subcutaneously. Short T-half, long T-half, monitoring by activated partial thromboplastin time, that is APTT, monitoring by antifactor 10A, although routine monitoring is not required. Anticoagulation can be terminated rapidly, useful in renal failure. There is no anticoagulation. You can give, I think, bevacizumab or Ibrut, some medicine is there. We come to those. Heparin-induced thrombocytopenia. So you have this antibody which is attached to the platelet factor 4 and which is attached to the heparin complex. It will stimulate the platelet by cross-linking factor 2A receptor. Heparin and there is an antibody which acts against the complex of platelet factor 4 and heparin. 5 to 10 of treatment despite being associated with decrease in the platelet. HIT is actually a prothrombic condition. More than 50% will have decrease in the platelet, thrombosis and skin allergy. Warfarin inhibits formation of vitamin K dependent clotting factors like 2, 7, 9, 10. Dabigatran is a direct thrombin inhibitor. Aspirin inhibits formation of thromboxane A2. Apixaban, rivaroxaban and edoxaban are direct factor 10A inhibitor. Low molecular weight heparin inhibits factor 10A activation of antithrombin 3. So we'll just revise these mechanism of action. Warfarin, what it does, it will inhibit formation of vitamin K dependent clotting factors 2, 7, 9 and 10. Dabigatran is a direct thrombin inhibitor. Aspirin inhibits the formation of thromboxane A2. Apixaban, rivaroxaban and edoxaban are direct factor 10A inhibitor. Low molecular weight heparin again is a factor 10A inhibitor. It will activate antithrombin 3. Now we come to adrenaline. Adrenaline is responsible for flight and fright response released by adrenal glands, alpha 1, 2, beta 1 and beta 2 receptors, and it acts on beta 2 receptor increase in the cardiac output, TPR, vasoconstriction, total peripheral resistant vasoconstriction in skin, and a narrow pulse pressure in the kidneys. Alpha adrenergic it will inhibit insulin secretion by pancreas, stimulate glycogenolysis in the liver and muscle, stimulate glycolysis in the muscle. Adrenaline dose and anaphylaxis 0.5 ml 1:1000 IM. Cardiac arrest 10 ml, 1 is to 10,000 IV or 1 ml of 1 is to 1000 IM. Management: accidentally injection, local infiltration of phentolamine should be given. Drug-induced impaired glucose tolerance is seen by thiazide, furosemide, steroids, tacrolimus, cyclosporin, interferon alpha, nicotinic acid, antipsychotics, beta blockers, slight impairment of glucose tolerance.